It's a new day in San Francisco. We're going to take a new approach.
San Francisco's new mayor promises a new direction to combat drug overdoses, but it is drawing mixed opinions. Good evening, I'm Ama Dates.
And I'm Dan Ashley. Thanks for joining us. Today is the latest step in what Mayor Daniel Lurie calls, quote, breaking the cycle of homelessness, drug addiction, and other related issues. We're following up because we want to see if this makes a difference in San Francisco.
ABC 7 News reporter Luz Pena is here to explain the changes announced today. Luz.
Yes, Emma and Dan, San Francisco has been distributing drug kits or supplies for decades. The initial thought behind it was to stop drug addicts from sharing needles and prevent diseases like HIV. Now, the new approach will require that any distribution of supplies be directly connected with treatment or connections to care. This is what harm reduction kits look like. They come with foil, pipes, and syringes to do drugs. They're distributed for free on the streets by a number of San Francisco nonprofits.
The evidence is clear. What we are doing is not working.
After decades of this harm reduction approach, San Francisco's new mayor, Daniel Lurie, is putting a stop to this policy.
We will no longer allow that in public spaces, meaning not on the street, not in parks, not on sidewalks. There is a place for that in a more indoor treatment controlled setting where someone can have a high quality discussion to try to get someone plugged into treatment.
One of the largest providers of safer use supply in the city is the AIDS Foundation. Their concern is people having to share supplies now.
Deeply disappointed that the distribution of safer smoking supplies will be limited throughout all public spaces. And injection of drugs over time has told us that we will see an increase of a potential increase of fatality. So increase in overdose, increase in HIV infection, and increase in hepatitis C.
We went out to the Tenderloin to ask people what they thought. We met Joshua, who told us he has been sober for 2 years now. Here's what he said about services. Has the city ever offered you supplies to get high?
Yes, mainly like in the Mission.
Has the city ever offered you help?
Well, no, I mean, there's places you can go, like there's places on 6th Street and also down sometimes like outside, like on the 16th and Mission.
This is a major shift that is giving nonprofits like Westside Community Services hope.
Real excited to see that Mayor Lurie is taking a stand.
The Department of Public Health said they will closely monitor overdose rates and HIV transmissions. Do you think San Francisco has been enabling people?
They truly have been enabling people. They enable people by allowing them and giving them the means to use.
San Francisco spends about $300,000 a year on providing syringes alone. The Department of Public Health has an annual budget of $3.2 billion. This policy goes into effect April 30th. We'll keep following the progress of the mayor's Breaking the Cycle plan for the entire year, telling you what plans actually work and which ones don't and why. Luz Pena, ABC 7 News.
Okay, Luz, thank you so much.